All right, take a look at these numbers here. A new study shows a shocking decline in mental health for mothers. Only 25% of moms as of 2023 say their mental health is excellent, which is down from 38% in 2016. And in the same span, there's been a 3% increase in moms who say their mental health is either fair or poor. Here to dig deeper is our mom panel. Amber Bergeron is a Louisiana mother of 4. Keisha King is a Florida mother and host of The Keisha King Show. And Jacqueline Stapp is a mother of 3 and the founder of Charm. And they all join me now, and we appreciate you doing just that. So, Amber, I'll start with you. Do these findings surprise you?
Not at all. It truly doesn't. It's very apparent there's an issue that needs to be addressed. We need more resources, we need more help, and we need it normalized to have these conversations.
And Keisha, a study like this is so important to highlight because it found that this mental health decline impacts women in every single category, from how much money they make to their political affiliation, Republican versus Democrat, down in all. And I'm hearing right now that we just lost Keisha. So Jacqueline, I'll shoot this question on over to you. What do you think can be done about this?
Hi, Carly. Good morning. You know, Carly, this is not just about moms who are under stress. This is an absolute public crisis, and we've got to speak up and bring more attention about this. I think we need to have more resources. We need to craft a program where moms can feel safe to ask for help, where we have mental health care. We need to make it affordable for moms to seek therapy. Our moms are the backbone of the American household. When they feel overwhelmed, it trickles down and the children feel it, and it affects the children. So we need to have realistic expectations of the mothers, the everyday working mothers that are, balancing work, life, kids, healthcare. We're humans too, and moms need to be able to reset and recharge. But the mental health care is super important because oftentimes moms suffer in silence.
Yeah, and realistic expectations. That's the key phrase here, right, Amber? Because another aspect of this, and it certainly wouldn't be the whole reason, but it most definitely doesn't help, is social media. And a mom going online and comparing themselves to another mother, and vacations and toys and what their kids are doing in school and where they are, how advanced they are, and what's going on there. The comparison element can really do a number on somebody's mental health as well.
Absolutely.
Yeah. So, Keisha, what do you think about all this? I believe that we just got you back. If we could bring up your picture, can we confirm that she's there?
I'm here. Can you hear me?
Okay, great. Yeah. All right. So, Keisha, hop in on this conversation and tell us what you think about this study about mental health with mothers and the decline of it.
Yeah, I think it's something that we, really need to be concerned about. Looking at these numbers, I noticed that the single moms are the group of people that have the highest effects of the mental health. And I think that's really interesting because we do see more, there's a lot to being a single mom. I was one before, so I definitely know. And we've been talking about this for quite some time as Christians and conservatives, where we see, being a single mom, you take on all this load by yourself. So of course, there's going to be so many different things that you'll run into, so many different issues. And of course, that is concerning to what your children are seeing you going through as well. And so it's too much to take on by yourself.
No, I hear you. And Jacqueline, I also want to point to this study really quickly. The numbers here are also very concerning. The percentage of adults age 18 to 49 who don't want any children at all is up 15% from 2002 to 2023. And the percent of adults who plan to have children in the future fell 20%. Jacqueline, the mark of a healthy society is one where the birth rate is either stable or increasing, and this shows the exact opposite. So what about that element of it and encouraging young people to have children despite these mental health issues that women are facing right now?
Yes, that's absolutely true. And like I said, excuse me, we need to have realistic expectations, and we need to empower women, not pity women, and encourage them to pave the way for them to have access and a seat at the table, because sometimes there's so much fear of balancing being a mom and putting food on the table and working and balancing, your health and your mental health. So if we can be more encouraging and compassionate and patient, and we've got to work together. And it's not just the moms, it's the fathers too. We need to learn how to co-parent together so that they feel safe and they feel confident of balancing work and balancing family at the same time, to encourage them to have a family.
Yeah, that's a great point. And it's a good thing that this is a topic of conversation today, right? The mental health of moms and dads as well, beyond that postpartum period. So Amber, Keisha, Jacqueline, thank you for joining us this morning to talk about it.
Thank you.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.